Welcome to the MD Edge Daily News for Wednesday, June 27th. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, intensive treatment for type 2 diabetes pays off in the long run.
Also today, diabetes patients are pushed into high-deductible insurance plans.
And obesity didn't just happen overnight.
But we begin with a review that finds that opioids cannot be justified for the routine treatment of musculoskeletal pain. Dr. Blair Smith of the University of Dundee in Scotland spoke at the 2018 European Congress of Rheumatology. Dr. Smith says that there is little evidence of benefit from the long-term management of non-malignant pain, but there is very good evidence of harm. That includes side effects like sedation, dizziness, and constipation. Dr. Smith recalled results from the SPACE study in particular. In that study, 240 patients with moderate to severe chronic back pain or hip or knee osteoarthritis were randomly assigned to opioid or non-opioid pain management. At the end of 12 months, a lack of benefit on both pain control and functional improvement from opioids relative to non-opioid treatment was accompanied by a higher rate of adverse events. This led the authors to conclude that opioids are not supported for musculoskeletal pain. Not all the evidence argues against opioids for non-cancer pain management, but those who support opioids do so for pain control only. The literature does not confirm an advantage for function or quality of life, which are the key endpoints. Dr. Smith says that the important thing for primary care clinicians to understand is that patients prescribed opioids should be evaluated early and frequently to gauge benefit.
Intensified multifactorial treatment proves cost-effective over time for patients with type 2 diabetes. This is according to a 21-year follow-up of the practice-changing Steno-2 study. Cumulative direct healthcare costs from the start of the trial in 1993 through 2014 were about $13 million for 24 patients in the intensive treatment group. That's compared with about $12 million for 42 patients in the conventional treatment group. This cost difference was not statistically significant, but there were significant cost differences at the patient level, and patients in the intensified treatment group lived almost 8 years longer. Joachim Gied of the University of Copenhagen presented the findings at the 2018 ADA Annual Scientific Sessions.
The bottom line is that as a doctor, you can prescribe a lot of medication to your patient, and you can actually, as a patient, be treated at a specialized diabetes clinic rather than at a family physician. And in the long run, it doesn't cost you anything because you save the money on complications.
The proportion of patients enrolled in high-deductible health plans jumped from 10% in 2005 to about 50% in 2014. This is according to a review of insurance data for 63 million Americans aged 65 years or younger. Diabetes patients often do not have a choice. High-deductible plans are increasingly the only ones offered by employers, and while that may be adequate for healthy people, it's quite another issue for people with chronic conditions. Harvard Medical School Associate Professor J. Frank Warham says that this trend is concerning. Mr. Warham spoke with MD Edge at ADA 2018.
There are things being done to reduce costs for patients with diabetes and high-deductible health plans. Some are specific to diabetes patients. So one health insurer instituted a health plan called the Diabetes Health Plan, where they reduced costs and had incentives for diabetes patients to comply with the care that was recommended to reduce their diabetes burden. So in other words, that was reducing costs.
And finally today, in America, it's possible to get more exercise, but still gain weight. Over the last decade, the steady increase in obesity among adults in the United States has been exceeded by the percentage of adults who are getting the recommended amount of exercise. This is according to figures from the National Center for Health Statistics. From 2007 to 2017, the prevalence of obesity among adults aged 20 years and older rose nearly 4% to more than 31%. During that same time period, the percentage of adults aged 18 years and older who met the federal guidelines for aerobic activity bumped up from 42 to 54%. Those guidelines state that each week, adults should engage in at least 150 minutes of moderate intensity aerobic physical activity, 75 minutes of vigorous intensity aerobic activity, or a combination of the two performed in episodes of at least 10 minutes. You can see a graphic of the exercise and obesity increase over the past 10 years by clicking the link in the podcast description. And that concludes the MD Edge Daily News for Wednesday. Today in the MD Edge Sitecast, the third and final part of the conversation on resilience. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. You can subscribe to MD Edge podcasts, including the Daily News and the Sitecast, wherever podcasts are found.